November is National Diabetes Month, so we decided to jump into the Big Blend radio vault of podcast conversations with Dr. Jackie Ubani and air an episode where she talked about the connection between heart disease, heart health, and diabetes. In fact, she's got a great article up on our site, blendradioandtv.com, that is linked in the episode notes. Take a listen and learn how we can help our heart and also our bodies and understand that connection between diabetes and heart disease. Welcome to Heart Healthy Living with Dr. Jackie, a Big Blend radio podcast that features Dr. Jacqueline Ubani, a board-certified cardiologist and electrophysiologist and author of the best-selling book, Women and Heart Disease, The Real Story.
Okay, so diabetes, there's 1 and 2. Can you explain a little bit about the difference between the two? Because in reading your book, actually the statistics were pretty alarming when I was reading it. You were saying that in the book as of 2014, there's an estimated 387 million people, 387 million people with diabetes around the world. Type 2 accounts for 90% of the cases. That's why I was kind of interested with Crystal being, the diabetes 1, which is something we actually don't hear much about. So when people hear about diabetes, I think they always think of diabetes type 2, right?
Right. So diabetes type 2 is the most common form of diabetes out there, and it's, like you said, it represents about 90% of the diagnosis of diabetes currently that we have. But let me explain to you what diabetes really is. So typically, all the organs in your body require glucose, which is a form of sugar, just the elemental form of sugar, in order to receive the nutrients that it needs to function normally. The biggest organ in the body that really uses glucose as an energy source is your brain, so it's very important. Now, you have an organ underneath your stomach called a pancreas, and the pancreas produces this hormone called insulin. So what insulin does is it allows the organs to extract glucose from the bloodstream so that the organs can utilize it utilize as a source of energy. So what diabetes is either lack of insulin or insulin resistance. So you have glucose in the blood, and your organs are not able to take it, to extract it from the blood to use it as a source of energy. And this high blood glucose just destroys all your organ system. Meanwhile, your organs are not getting the sufficient energy it needs. So you can think of glucose, or you can think of insulin as the key that the glucose needs to get into the cell. So if glucose does not have this key to get into the cells, it doesn't. So all your organ systems suffer because they don't get energy, the energy source that they need, and you have high sugars in your blood, and just having high blood sugars circulating through the blood system is also a dangerous thing. It just destroys all of your organ systems. So that's diabetes in a nutshell. So you have two forms of diabetes. You have type 1 and type 2. Type 2 is the most common form of diabetes in this country, and it is genetic to a certain extent. People can have the genes for it, but you don't necessarily manifest diabetes type 2 unless you have risk factors like obesity, physical inactivity. So in patients with type 2 diabetes, they do have insulin, but because of obesity and other risk factors, their body is resistant to insulin, so they need twice as much insulin to be able to extract the sugars from the blood. And because of obesity, they lack that. Whereas type 1 patients don't have any insulin at all. For whatever reason, their pancreas has been destroyed either by an autoimmune process. That means the patient, your immune system has gone in to destroy your pancreas for whatever reason. And so you have zero insulin. And when you have no insulin, then you have high blood sugars, and the sugars cannot get into the organ system to as a source of energy. So two types. Type 1 is not as common, but type 2 is the most common because of, risk factors. And like we always talk about, obesity is growing in this country, and as a result of this increase in obesity we see an increase in insulin resistance, and therefore an increase in type 2 diabetes.
And that's the thing. In your book, it was pretty scary. I was reading that Okay, so diabetes, between 2012 and 2014, there was an estimation of 1.5 to 4.9 million deaths have occurred because of diabetes being part of that role of that, and that the number of people with diabetes expected to increase by 2035 is to increase by 592 billion. I mean, this is crazy. So
this is crazy.
The main thing is this is if we go over our 5 ounces of wine a day. It's National Cheese Day, Dr. Jackie. So this is dangerous.
Right.
And yesterday was
dangerous.
National.
Go ahead.
No, this was National Bubbly Day yesterday too.
But it's
been a naughty weekend here.
No, but it is very interesting that everything that's marketed and heavily marketed, like when you go in the grocery store, when you're at the checkout stand, there lies the candy. Mm-hmm. You know, I mean, sometimes they put bottles of water there too. But, you know, it's like everything that is really, really bad for you is heavily, heavily marketed.
Yeah. It is.
You know,
it is. And it accounts, and that's why there's so much obesity and physical inactivity. I know you guys drink your 5 glasses of wine and then you take a hike. You know, you have to exercise, and that really, really helps, you know, because there's some people who have the genes for diabetes and never manifest it because they're in good physical condition.
Oh, okay.
They're in
so this
shape
could be
and they
genetically
exercise.
Passed down.
Yeah.
So you've got to watch the genetics too.
Yes.
Wow.
Yes, it's genetically passed down, but you don't necessarily manifest it if you're living a clean and healthy lifestyle. So lifestyle choices are important.
I was going to say that's the thing. You know, we on the shows we always joke about, oh, it's National Cheese Day. The other day it was National Donut Day, and I haven't had a donut. I can't remember having a donut when the last time. I think it's got to be at least. I'm going to stretch out to probably 10 years.
Donut Day? There's a National Donut Day, really?
Yeah, and today's National Cheese Day.
Well,
yesterday was Bubbly Day.
I wonder who thought it up.
So Friday. It was, you know, I knew that June was our Big Blend anniversary, and we're celebrating 20 years. But with the publishing things, we're like, yay, we get an extra 5 ounces. But so I did this stupid thing of I was like I couldn't stop thinking about donuts, so I bought us donuts. I have to tell you, even thinking about them makes my teeth bend, and they sucked. They tasted just horrible. I don't know what it was. It just because your body isn't used to it, and so I'd rather have another 5 ounces. But this is like I know better. Like remember we were talking about the holiday season. I was like, I could hear all the stuff in the back of my head. I hear you, Dr. Jackie, on my shoulder, and I just said, well, Dr. Jackie, it's our birthday. We get to have cake, and let's just at least have one donut. And I have to tell you, when you don't eat that kind of stuff, and it wasn't exactly a decent donut anyway. I just grabbed donuts on the grocery store because it was like, hey. And then I was like, that is the stupidest thing we've done. I have to tell you, I didn't enjoy. Did you enjoy your donut, Nancy?
No, in fact, you know,
it made me feel sick.
That's exactly how
we both felt sick. I don't know. Your body, once you train your body to be clean, it knows better than that kind of thing.
When you get rid of all that sugar from your diet and you go for, you know, a prolonged period of time without eating it, you don't miss it. And then when you try it, you realize, oh, this isn't, you know, it's not that good. But then if you continue to eat it, your body gets used to it again and you crave it. But you really can cut it out of your diet and just not crave it anymore, you know, when you stop doing it. So, no, I did. I haven't had a donut in a long time. I can't believe there's a National Donut Day. And what are you supposed to do?
Yeah, I know, but it's National Cheese Day today. But we have to watch cheese, too, right? You told me that even my little goat cheese we have to watch that.
Yeah. Well, cheese in moderation. Of course, everything is in moderation and not overly indulging in cheese. Because I like cheese, too, and I can't imagine cutting that out of my diet 100%. But in moderation, anything is okay.
I find it interesting, you know, and maybe as a parent, people might want to take a look at the reward system, which works well. I mean, there's if you misbehave, you're going to your room, and sometimes that's more of a reward than a punishment. But the idea of rewarding children with something that's bad for them,
a cookie
or a piece of cake or candy. You know, when you really stop and think of it, when did that happen where...
sit down in front of the TV with a donut.
Yeah. Well,
Stop
yeah.
making a noise.
That's just to shut you up. But
but then we're doing two things that aren't good.
But
is that what happened to you growing up?
No, that didn't happen.
No, but the reward system,
Yeah.
when I think about like Christmas and candy canes and
Yeah,
all this
yeah.
great, this colorful candy that is really, really bad for you. And as a parent, it's very difficult to say, okay, guess what? You get a carrot. And
Yeah,
everybody
I know.
else is getting a candy cane, but if people stop to really think about it as you're rewarding your child, it's like,
Right.
here, have a candy cane, and maybe someday
Right.
you too will have diabetes.
Yeah, so that's what
I
think
know.
there's
So right, associating sugar with good
Yeah.
behavior is probably not a good thing psychologically to put on your child.
Yeah.
Yeah, that's probably not a good thing. Maybe they can get a vegetable for being good.
carrots.
Yeah.
A piece
They
of
taste good of
broccoli.
fruit.
Yeah.
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 Okay,
Yeah.
I'd draw the line at broccoli.
But no, she's just how it's prepared. She's not good at the green vegetables. I sneak them in there, Dr. Jackie. I sneak them in all the time. She doesn't, it's like I just sneak them in there, and then when she's eating her salad, I watch her face. Did she pick that one up or not? Did she know that I crumbled broccoli in there? But this is the thing what I find very interesting about the diabetes part. I want to talk about some of the other things that happen because you're saying like it really affects your organs, your blood vessels, but it's genetic. But also, what I want to know is, okay, so say I get diabetes and then I get pregnant, and maybe diabetes came from my lifestyle habits because I went over the 5 ounces of wine, I ate the cheese and the cake, didn't walk, watched TV, So my lifestyle habit made me get diabetes. Which is reversible at the beginning as far as I know, and correct me if I'm wrong, but if I get pregnant now, can my child pick up diabetes from that and I start the genetic cycle?
Yeah, because you have the gene
Wow.
and you're predisposed. Yeah, your child has the gene as well, but your child may not manifest diabetes if they lead a clean lifestyle. So yeah, so it's we recently discovered that type 2 diabetes is actually genetic, because a lot of people don't manifest it if they're living a healthier lifestyle. But when you start gain weight and then you can manifest it. But one thing I wanted to mention was that diabetes is a serious risk factor for heart attack in women. If you have diabetes, your mortality rate, that is your death rate, is much higher in women than women that don't have diabetes. And also, even comparing diabetes in women and men, diabetes appears to be more serious in women than it is in men. Women tend to have poor quality of life as a result of their diabetes, and they tend to die at a higher rate than men with diabetes. So it's a very serious risk factor for diabetes, and really should be taken seriously. We actually consider diabetes to be what we call a coronary artery equivalent. That means if you have diabetes, your risk for heart disease is about the same as a person who's already had a heart attack. Because we know that if you've had a heart attack once, your risk for a heart attack increases. So if you have diabetes, you're already considered at the same risk level as somebody who's had a heart attack. So it's a very, very serious illness, and it really should be taken seriously. And the reason I stress this is because a lot of people are asymptomatic during the early course of the disease process. And so they don't get checked out, they don't take their medications, they eat whatever they want. But the complications start to happen after you've had diabetes for almost 10 years. And at that point, it's irreversible. And when you start needing your limbs chopped off because of diabetes, or you go blind, or you need dialysis,
Damn,
at that
Dr.
point,
Jackie,
nothing.
do you have to say that? I don't want my fingers and
I have to put it out there and be as real as possible. Diabetes is nothing to play with. So you have to be. I mean, of all the risk factors, this one is really the worst one. And again, it's because people are asymptomatic for the most majority of having the disease process. They're asymptomatic, and then at 10 years, everything starts. And at that point, there's really nothing much you can do.
So how do you know if you have diabetes, and when should you go and have it checked up? I mean, because do you think everybody? I mean, the healthcare system is really up in weirdo land right now, and I mean, so I'm going to guess that the majority of America doesn't actually go get checkups. That's just a wild guess on my part, and maybe I'm wrong. I'd like to say that, but I have a feeling not.
Yeah, you're probably right. People don't typically go to get checked up for diabetes, but we usually recommend, or my society, American College of Cardiology, recommends screening should at least start at age 45, unless you have other risk factors, like if you're obese, if as a woman you've had a baby that's over 9 pounds, or if you have high cholesterol, a family history of heart disease, then you should get screened earlier. And it's usually just a blood test, a screening blood test. And if you ever go to your primary care doctor and you get blood work done and they tell you to fast, they most likely are also checking you for diabetes. But it never hurts to request to be screened for diabetes when you go in to see your primary care doctor.
This is important, like what you're saying, and I have a few friends who, and it's true, it actually started happening in their 40s and 50s, mid-40s and 50s, and they had diabetes, but they said that their doctor was like, you are at this point right now that you're going to experience it all unless you change your diet right now, and this is what you do. And they did, and they started exercising, and it actually reversed it. And it was really, and it's a process. And you started to, and it was interesting watching them go through this process of what to eat and what you can't eat. And there are choices. And I look at I'm not saying everyone should be vegetarian. Everybody's body is different. But piling up more vegetables, just from all the interviews we've done over the years, it seems that every diet seems to be eat more vegetables, and eat more vegetables. It seems to be that we're not eating enough veggies, like really, as a society.
Absolutely. I completely agree with that. Nancy. More vegetables, cut back on carbs a little bit. But vegetables, protein, that's all good for you. Absolutely.
So, Dr. Jackie,
I think vegetables are good as long as they're raw. As soon as people start cooking them, they suck.
But there's a whole technique to that, and that's why we have chefs come on our show to teach us that. Like Dr. J, we have Chef Ivan Flowers who comes on, and Jeremy Manley teaches everybody vegetable cookery. That's underrated.
A good example is spinach. Cooked spinach sucks.
No.
It does. But if you have
fresh
spinach in a
really
salad,
good.
It's good.
Yeah.
And then if you throw a little bit of fresh spinach in like a soup, it's fine. But cooking spinach sucks.
Oh, did I say omelet? I have a funny feeling Dr. Jackie's going to go, omelets are too high in cholesterol. Am I right? Uh-oh.
Well, the yolk, you take the yolk out. If you eat the egg whites, you're okay.
Okay. So there's a cholesterol thing.
You can have an egg white omelet. Yes.
Okay, we can try. So now, when
my mouth is wide open,
I'm so jumping up and down. I can't wait to tell Dr. Jackie what's going on now. Now you know how we talk about our walk.
Me.
Very excited, very excited.
Because she's the inspiration for it.
This is all your fault, Dr. Jackie. No, there's
awesome.
a few other people involved too, some travel writers as well, and just some of the feedback we've had over the years of going to national parks and walking. And remember, you wrote the article for our Spirit of America magazine about the benefit in going to national parks and walking and physical activities and 150 minutes a week, everybody, is all we need.
Yes,
150
minutes, that's all.
So I have this thing about walking, Nancy, that's our morning way to start the day, is to watch the sunrise on a morning walk. And also pair it up with the fact that people seem to think you have to be some big athlete to get outdoors, and go to a national park, that you have to climb a mountain, that you have to be able to carry a backpack, and yes, if you want to take your champagne with you, you do. But anyhow, here's the deal. So we were like, let's do an article series, but it just didn't feel like we had to do more than that. And so we've started an article series called 1 Hour Walks, because it's just go out for 1 hour. And the walks, yes, there's going to be some where we do climb up crazy places, but the majority of them, it's about just take a walk in your neighborhood, to actually look at your neighborhood, put your cell phone away. So there's this, it's not just the physical activity that you talk about, but there's also this mindfulness that comes from it, because you talk about the benefits of meditation and being calm and breathing.
Right.
Then there's also the joy you get if you go with someone and you actually have a conversation instead of texting through the message. Through the chat. And then, so this 1 hour walk, that's what we're doing. We started a video series called the 60 Seconds of a 1 hour Walk. So people understand, okay, there's this time you go into, like on travel, like if you travel somewhere, you go, hey, it's a 1 hour walk in a downtown destination or something like that. Maybe it's a park or it's your neighborhood.
Yes.
So we started this, but we also started a Facebook group to get people on board. It's like a challenge to take a minimum of a 1 hour walk a week. So we're a little shy of your 150 minutes, but there's, we're starting off slow just to get out and take a 1 hour walk a week, and they post their photos. It's hashtag 1 hour walk, and it's spell out the word one. And we've had people from England, we've had the Rio Grande of New Mexico, we've had, oh my gosh, Oregon, we've had San Juan Bautista, California, Botswana. We've had all these places of 1 hour walks happen so far. So
that is awesome. What is this hashtag? Tell me the hashtag again. I'll have to join it.
Yeah, I'm going to add you. It's 1 hour walk. And your article's in there, and people were like, oh, this is proof and evidence that this works, and it's cool. So it's a support group for all of us who need to get out there and move our butts.
Oh, my goodness. This is wonderful. This is so wonderful. I'm so happy that you've started doing this and encouraging people to walk. That is wonderful. I'm definitely going to try to join this group. This is awesome.
And everyone, you can tweet us. Tweet us with your 1 hour walks on Twitter, and we'll retweet them.
I will.
It's about starting a movement around the world, not just this country. We want people, it's a way of seeing our countries, having a positive conversation. I mean, to me, this is better.
And meditating and, spending an hour to yourself, or even if it's just having a friend with you, or just, doing something that's mindful and it's it's heart healthy. So, yes, absolutely. I think it's a wonderful idea. It's a wonderful idea.
Cool. Now, Dr. Jackie, if you could take a 1 hour walk with anybody in the world, who would it be that could be alive or passed on, and where would it be?
Where would it be?
That's a new question on all our radio shows now, too.
It would be with, I would say, who would it be? With my best friend, Andrew. And my best friend, because we talk, we have so much to talk about, and I just feel just myself with him. I can just say just about anything, and it would be at one of our national parks. It would be probably, I would say, Arizona, the Grand Canyon area. Yeah, and we would walk for an hour and talk about life, and talk about just spirituality and our well-being, and just enjoy the nature, take in the fresh air. Maybe early in the morning so we could watch the sunrise. That would be just magical. That would be absolutely magical.
So much fun.
Yeah.
I like this.
Yeah. And maybe a glass of wine at the end of the walk. 5 ounces.
Well, I'll tell you what. We went on a hike into Madera Canyon yesterday, and it was rocky and uphill, downhill, not major, but man, the next thing you know, I was balancing over rocks to take photos, and my butt was in the air, and then a squirrel started barking at me. So you never know what could happen on these.
He felt threatened.
Yeah. So there's this. It's just really cool. And by the way, you're now added to the group, so there we are.
Cool.
So
okay.
That's awesome.
We've got our Dr. Jackie in the house. We're excited about this because we felt like we had to take action. It can't just be, this is what you need to do. Let's do something positive. Let's change our health together. Because, I have to tell you, since all of our walking, I have lost one spare tire around my waist.
That's awesome. That is awesome. So maybe you'll never manifest diabetes in your lifetime. Now that you've lost some weight.
We're hoping not. I have to watch the champagne, though, because I do get excited about that. And we've had a naughty weekend as much as we've hiked. So now tomorrow we're going to get back onto a little bit more stricter regimen. But I wanted to go back to diabetes because there's you talk about the exercise and the health and food part of it. But one thing I wanted to touch on, because you're saying it's so interconnected, like how our heart is, right? What about, because you talk about blood sugar, and if your body if you've got diabetes, that means you've got that part where the obesity is in there. Are you not taxing your body at this point where it's working harder to pump blood? So I don't know if I'm making sense with this, but if you are not at your better weight and you're not at your better health, right, isn't your body working doubly hard? And wouldn't that start to put it into an alarm mode where, like you were saying, autoimmune with the pancreas, right, pancreas thing? Wouldn't it kind of start to put it into like alarm, we're not healthy? And then wouldn't it also spur some kind of blood pressure issue too, because you're in this state of not being calm and healthy? Did that make sense?
I mean, they're
trying to look at the body as a whole.
Yes, absolutely. You're right about that. It's, you know, with physical inactivity and, you know, having a lot of fat cells in your body, you, again, like I talk about, it makes your body resistant to insulin. And if you are resistant to insulin, your organ system cannot pick up the glucose from the blood that it needs for nourishment and to function properly. You know, all your organ systems, they need energy. They need food. That's why we eat food, but we're supposed to eat healthy food. But that fuels them with what they need to function. And if you gain weight and you're not able to extract, you just kind of cause problems with your organ systems. They're stressed out, and they start using other fuel sources, like breaking down your muscle mass, which is bad, and breaking down other sources to use as food because they're desperate for food, and that makes you feel sick. It makes you feel lightheaded, dizzy, makes you hungry and thirsty, and so you're eating more, and not because you know you're hungry, but because your organ system is craving what it needs and it can't get it from what you're eating. So it's a cycle that just keeps going and going and going. So yes, so not exercising, eating poorly just makes your whole body stressed out, and that's what predisposes you to death at an early age.
I don't want my limbs gone or to die.
I know.
I'm not ready.
Are women more at risk because we have more organs? Are we harder to handle?
It's that birthing thing.
Women are not per se at a higher risk of having diabetes, but women tend to have a poorer outcome when they have diabetes than men, and it's not clear why. It's just something that has been observed. So it's not because we have any more organs, but we suffer more when we have it than men.
Oh.
So maybe it's because, I don't know this, but maybe it's because men get diagnosed early for whatever reason, but it's hard to say. But the studies have shown that women just have a poorer outcome and they die more frequently. And it's just a more serious illness in women than it is in men.
Huh. Well, it's like with heart disease, women are at the top of the list here, but it's one of those silent killers that you don't even know you're having a heart attack. And that's something, I always ask you on every show, how does a woman know if she's having a heart attack? Because I just, every time you come on, I want people to know this.
But that's because men are like Sanford and Son. They like, when they get sick, they wail about it. Women just shut up.
And keep working.
Yeah, I know. And it's, you know, everyone always expects, you know, the men have heart attacks. So when men show up in the emergency room, even complaining of chest pains, you know, everybody's thinking heart attack right away, and they do all the appropriate things right away. They get all the consults they need, and men get treated quickly, and so their outcomes are better. When women come in, you know, a lot of times they show up later because they don't even think that they're having a heart attack. They tend to have symptoms that are not classic for a heart attack. About 50% of women will have chest pains with heart attack, but the other 50% don't. They have non-specific symptoms. So when they get these symptoms, they don't even think that they're having a heart attack, so they don't even go to get medical care until later. And by the time they show up in the emergency room and people don't suspect that they're having a heart attack, they don't get treated till later, and therefore their outcomes are poorer than men.
That's because women are more complicated.
Well,
yeah.
But
that's why they didn't let us vote for so many years.
Again, tell everybody, how do you know if you're having a heart attack? What are some of the things we should watch out for as women?
So chest pain again is the one, you know, 50% of women have that. But the other non-specific signs would be for women: nausea, vomiting, GI upset kind of symptoms, shortness of breath, fatigue, and you know, just not feeling well. A lot of times women just say, I just can't articulate it, but I just don't feel well. So sometimes it's difficult to know that you're having a heart attack, but I always tell my female patients, one, you should know your risk factors for having heart disease. In my book, I have a list of the risk factors, which you guys all know about: physical inactivity, diabetes, hypertension, and all those. So if you have multiple risk factors for heart disease and you're having 1, 2 to 3 of these non-specific signs and symptoms, it's much better for you to go and seek medical care ASAP than to just ignore it and keep going. So, because it's better to be told you're not having a heart attack and, be discharged from your doctor's office or the emergency room than to be told, you've had a heart attack a week ago, why are you just coming in right now, and then have a poor outcome as a result of that. So, one, knowing your risk factors is very important. 2, knowing some of these non-specific signs and symptoms. So if you're having multiple of these symptoms and you know that you're high risk for heart attack, you should get checked out ASAP for these symptoms.
And this is what I love about your book, and everyone, Women and Heart Disease: The Real Story. Number one, you give examples. You tell people stories, and so we can identify. And it's relatable. We can understand what you're saying, because a lot of times it's like, okay, here's all these big words, and I have a problem with big words. Anyway, so no, but it's true. It's like, and that's the thing. Like when someone says, "No, let me show you how this computer program works," we all go, "Oh God, please don't make me do that." And it's the same thing, I think, with health. We get into, there's a fear factor of knowledge, and that's the problem.
Right.
And you've made it so relatable that we can understand these stories and see ourselves in different ones and understand personalities. But I think what's great is, you talk about these risk factors and you bring in diabetes and you bring in all these different things that we've been talking about, hypertension and even, hormones and all these different things that play into what happens to heart health. And it's something like what Nancy's always been saying on these shows of health, like if you're taking this medication over here, if you take this over here, you could be having a problem. They may not be working together. I think what's really great is that you've put this comprehensive idea of understanding the heart, how everything affects the heart, how everything does. And so if you're sick over here with that, that's going to affect your heart here, and that's one of the biggest things we can look out for. But I also believe that everything you talk about what we should do for our heart health is that it's going to help us on all the different diseases we're looking at. So if we're watching obesity and we're watching about how much wine we have, I always giggle about that, but more women are drinking more and more than men these days. So there's this new thing for that. There seems to be like, hey, we can chug this down over here, but so that's why I bring it up. But it seems that if we eat and do the activities that you say to do, 150 minutes a week of exercise and physical activity, that will help our bodies regarding diabetes, even cancer. I mean, because women are getting breast cancer. One of the top things is from drinking too much booze. That's a reality.
Right, exactly.
So I think what you're saying is you're like full, like it's like comprehensive everything, man.
Yeah,
you look after your heart,
absolutely.
You're looking after everything. Yeah.
You're looking out for everything,
cool.
Exactly. Most things have the same kind of risk factors. Physical inactivity overall is bad. Eating unhealthy is bad. So if you can, eat well and exercise and maintain a healthy weight, it's not only good for your heart, it's good for most of your organ systems and helps prevent a whole lot of other diseases as well. So, yes, it's all related. It's all related. And people seem to have the same, questions about, the heart. And so putting this book together and using examples is a way of just me being able to teach people about heart disease and just sort of hear this perspective of other patients and how they come into the doctor and the questions that they have about their illnesses, which you probably have too, but have never asked a doctor about it. So you can relate to these people because you probably have the same questions and never asked anybody about it. So,
and sometimes you don't know what to ask. You don't know what to ask.
It is. You don't know what to ask until somebody else asks it, and you realize, I was always wondering that, and I'm glad that you asked that question. So it's a way for all of us to learn together about heart disease. So.
Well, you rock, Dr. Jackie, but you gotta give us your champagne toast before you go, because what's it? Do you drink champagne or is it always red wine? I mean, look at her 5 ounces here.
I drink champagne.
Or is it a Pinot Noir?
On occasion, on occasion I do drink champagne. So I would say this is a toast to 1 hour walking, because I'm going to start. I'm going to join your 1 hour walking group and incorporate more physical activity to my life. So here's to 1 hour walk.
Right on.
Cool.
We expect your 1 hour walk photos from South Africa. That's what we want from your last trip.
That's right. Yes.
And you're already added in there. So you're in there, and I can't wait. I think it's so exciting. And to me, it's like a 1 hour walk. To me, it's about attention to detail at the end of the day.
Yes.
Because when we don't have attention to detail, that's where things sneak up. That's where your bills pile up that you didn't know you were spending money on. That's so there's a stress level, and it goes all the way to politics. And I don't want to bring that up. It's champagne. But attention
you don't want us to start fighting this morning.
Stress all the way.
Yeah, I know. Well, we won't get into the medical system either, or healthcare, but on that. But anyhow, but the best healthcare you can do is to take care of yourself. At the end of the day, that's the most important thing. So appreciate your time and your book, Dr. Jackie. Always so much fun having you on the show. Again, everyone, Dr. Jackie's book is Women and Heart Disease, The Real Story. Of course, you can get it on Amazon, but you can go to our website, womenandheartdiseasebook.com. And also, if you go to blendradioandtv.com, look in our expert department, and you'll be able to click on Dr. Jackie. And everyone is Dr. Jacqueline Eubany, Eubany. So I always call her Dr. Jackie, but you need her last name so you can find her book. But thank you again, and listen, have a great rest of your Sunday.
You too. Thanks for having me. It's always a pleasure hanging out with you ladies. So you guys enjoy your Sunday.
Next time we'll be on a 1 hour walk. Okay, take care.
We'll be on a 1 hour walk. All right, you take care. Bye.
Bye-bye.
Bye-bye.
Thanks for joining us on Big Blend Radio's Heart Healthy Living Show with Dr. Jackie. New episodes air every second Wednesday at 12 p.m. Pacific Standard Time. You can keep up with Dr. Jackie at womenandheartdiseasebook.com. Listen to the shows at bigblendradio.com.